Welcome everybody, thanks for joining us. The topic for today is kind of a background of marketing theory to help you prepare for putting together your marketing plan, which we'll talk about in a minute here. Our speaker for today is Dr. Stephen Castleberry, and before we move on, I just want to point out this picture that we have of him on this slide. So when we asked Dr. Castleberry to facilitate this webinar, and we asked him for a picture of himself to put on the first slide, he happened to send a picture of himself, well, probably not by accident, of him with our office in the background. So if you look behind his head, you'll see Lake Superior behind him and the Duluth Lift Bridge. And if you follow kind of the left side of that bridge down to the ground, there is a brick building right in front of the left side of the bridge, and that is our office building. So if you've never been to our office, that is where we sit. Rural Health Innovations is, as many of you know, a subsidiary of the National Rural Health Resource Center, and in partnership with the center, our job is to connect rural health organizations with innovations that enhance the health of rural communities. So the question is, why are we talking about marketing today? This is really about continuing on the foundation that you've been building so that you can be successful and to really set the path for sustainability, which is the ultimate goal of all of the networks in this cohort. And you really need a good strategic plan. You've got a good strategic plan. You've got a way to evaluate your progress towards your goals. And now it's time to continue to build on the work that you've done with your marketing plan. So this webinar and the creation of your marketing plan is kind of sets the foundation that we'll build on with as we go on in the rest of the grant period. Marketing planning is critical so that you can thoroughly understand your member needs, that you can ensure that the services that you provide are ones that meet the needs of your members, and then that you can spread the message to your stakeholders in ways that are not only effective but that are meaningful for them. So here's kind of the big picture and how what we're doing today fits into that. Your marketing plan, if you look over on the right side of this screen, the marketing plan is due December 31st, and we'll be spending the next couple months helping you get ready for that. Today's webinar will give you some things to think about and things to talk to your teams, your boards, your members about as you work on putting your plan together. And in fact, in the bottom left corner of the screen, there's a handout that includes some helpful discussion and reflection questions. So while we won't be referring to this handout directly as you go through this webinar, the document's intended for you to use as you prepare to build your marketing plan. So I encourage you to download that document and pull out the pieces that are relevant to you. Then we've got a webinar on August 16th that'll walk you through the marketing plan toolkit, which, just like your strategic plan and your evaluation plan, will consist of a template for you to fill out and a guide with a lot of definitions and a lot of background information, as well as its instructions for filling the template out. There will also be a document that has some sample marketing plans, so you can see how other networks have developed theirs in the past. Just to note that for 2019, we'll be continuing to build on the work that you do to put your marketing plan together. So your business plan really meshes very well with the marketing plan and continues to build on that. Your business plan will be due July 31st of 2019. And then the sustainability plan is due at the end of 2019, December 31st. These three deliverables together, the marketing plan, the business plan, the sustainability plan, all help you toward your goal of sustainability. Here are our objectives for the day. In this webinar, we'll help you use marketing research to learn more about network members' unique needs and concerns. We'll look at how network leaders tend to interact with information and individuals as they evaluate opportunities for joint engagement. We'll look at segmenting and developing target markets within a network. We'll help you develop ideas and programs that meet real needs of network organizations. And we'll help you think about using marketing communication tools to present collaborative ideas to the network. As I mentioned before, our speaker today is Dr. Stephen Castleberry. Steve is a professor of marketing and business ethics at the University of Minnesota Duluth, where he has won many major teaching awards. He's published over 50 refereed journal articles in national and international publications, is the co-author of the #1 textbook on selling, which is in its 10th edition and is published by McGraw-Hill with English, Spanish, and Chinese editions. And he's an active consultant and trainer to industry. Steve has also owned and managed his own publishing company for the last 22 years. He has significant personal and professional experience related to rural areas and rural health, and I'll let him give you those details himself. And with that, I will turn things over to Steve.
Thanks so much, Shannon, and good afternoon, folks. As Shannon said, I am a rural person. I was raised in the country and have lived in the country for most of my life. As an example, I sometimes tell people that the emergency room that I visited as a child was actually a 3-room hospital. Imagine that, a 3-room rural hospital. And I work with rural healthcare a lot over the years. As you can see in this slide, I sold computers to every kind of rural healthcare institution, as well as rural government institutions in the southeast of the U.S. So I've worked with rural mental health clinics, for example, as they provided services while working with partners in a network. I've also served as a rural medical first responder for 10 years, as well as a volunteer firefighter for almost 20 years, where again I've worked closely with the healthcare institutions in my area. I'm looking forward to sharing some information today about marketing in the remaining time that we have. And I would suggest that many, if not most of you, are actually engaged in some form of marketing right now with your current position, whether you know it or not. So let's take a look at a simple definition of marketing. And you can see it there on the slide. To engage in marketing is to discover and meet the needs of the network partners to the mutual continuous benefit of all parties. So we're not just serving up something that we've created without thinking about their needs. And whatever we create, it has to benefit and meet all parties' needs, including ours. And of course, our goal is to benefit continuously and not just today. To meet their needs, we're going to need to learn what their needs are. So we're going to spend a few minutes talking about how we might do that. Now here's a key takeaway. Da, 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 da. That's a trumpet in case you couldn't tell. People are not exactly like you. People are not exactly like me. That's the takeaway. Organizations are not like my organization. And did you get that? Let me state it again in case you didn't. People and network players are different. You know, intellectually, we know this is true, but I see so often that when people start to engage in marketing, they seem to forget that notion. And they create things that they would like and communicate the way they would like to be communicated with. And that's not what we're all about as marketers. So why do we need to learn about the uniqueness of our partners? Well, there are actually a lot of reasons for that, and let's talk about a few of them. First of all, it will help us to better discover the value that we can offer each network member. What are the pains that they're experiencing that maybe we can relieve? What can we do to give them gains that are really meaningful for them? By doing this, we're going to improve how we make decisions. For example, we're going to be able to discover the best alternative in terms of program structure and the best way that we should implement that program. Second, by learning about their uniqueness, we can discover why things that we're implementing sometimes just are not working. Should we change our programs and products? And if so, how should we do that? If I really, really know my partners, I'll know the answers to those questions. Let's start with an example. Let's say that you want to partner with community organizations, hospitals, and rehab facilities. Your goal in all of this is to help stroke patients return to living their lives productively. That is a great goal. Now, in a previous webinar, many of you learned the technique of brainstorming among your own team members. You learned to, say, sit around a table and ask the question, what are the pains and the gains that network member experiences while working to achieve their goals. And this can be extremely valuable because some of your team members might have a long history of working, for example, with a certain community organization. And that team member can bring to the table that partner's issues very well. You can also check in your office files. You may find some histories of working with these partners. This might include a working draft, let's say, of a proposal with a hospital a few years ago. It might be a PowerPoint that was created for a rehab facility, say, 6 months ago, and so forth. The takeaway here is simple. Don't forget to look at the information you already have and already know about your partner's pains and what gains that they can use. But of course, there are many other ways that we can learn about their needs, and we need to consider them. And so let's do that for a few minutes. We can't assume that we have all knowledge and all information in our office and within our own brains. For example, we may use secondary data, which simply means pulling together information that already exists in other places. For example, there might be a newspaper story about a rehab facility that mentions in that story what their long-term goals are. Or we might see something on a hospital's webpage that indicates that they're changing their strategic direction so that now they're planning to focus more efforts on aftercare more closely in order to improve patient outcomes. The key is to search, to scan, to read for information that will help our team learn more about our partners and their needs and wishes. Are you doing that now? When was the last time you spent, let's say, 15 minutes really studying sources from other places that might talk about your partner's pains and gains? We can also create surveys to give our partners. Now, these don't have to be long, complicated surveys. We can easily create them on the web to make them easier to complete and easier to compile the results. Who would we survey? Could be anyone, but right now I'm thinking of surveying people in your partners' organizations. Have you ever used focus groups? This is where you get, let's say, 6 to 8 partners in a room and let them brainstorm their pains and what gains they need. Now, this is not a survey where you have everyone in the room sitting around and you ask each person the same question. Oh, no. What you're trying to do is to get them to talk among themselves. And what you do is to moderate and help start those conversations. I've conducted many of these in the past, and the perspectives have always been insightful and sometimes, I'll have to admit, very unexpected. You may find out, for example, that a community organization has a great idea that dovetails nicely with what you're thinking about. Or you might find out that a long-term care facility would have absolutely no interest in partnering in one potential scenario that you're thinking of. Again, because of a reason that you've never even expected. Depth interviews are like focus groups, but with, yep, you guessed it, with just one person at a time. These usually last about an hour. If you decide to use this, please explain to them why you're having the interview. You're there just learning about their pains and learning about the gains they could use. You're not there trying to sell them on any idea. If you do collect data, here are a few best practices for gathering information to learn about those pains and gains. Now, we obviously don't have time to cover everything in this short webinar, but these points will hopefully get you thinking about wanting to do things correctly. So first of all, when you ask questions in focus groups and depth interviews, try to use open-ended ones. Why? Well, you'll get more information. You can see the example on the right-hand side of this slide. With a closed format, you only find out one piece of information, which is how often patients call post-surgery. Open-ended format, the answer can span well beyond just post-surgery calls. Second, avoid double-barrel questions in surveys. This is where you attempt to ask two questions in one. From the example you see here, what if November is a good time, but I'm not open to supplying a nurse for the event? Should I answer yes or no to the question? You'd be surprised how many times I find double-barrel questions on surveys. Make sure whatever you ask is clear and that it is easy for the respondent to supply an answer. Third, before administering any survey, pre-test it. Show it to 5 or 6 respondents and ask them if anything is unclear. What can seem totally unclear to you, you wrote it after all, totally clear to you, can be totally unclear to someone else. For proof, just think about some emails you have sent that you have totally have been misinterpreted by someone else. So skip this step of pre-testing, and you very well may regret it. Let's spend a few minutes now talking about the importance of discovering how network leaders use information and interact with others as they evaluate opportunities for joint engagement. Again, people are different and won't do things the same way that you do them. As network partners, we will likely come alongside these network leaders at many points along their decision-making journey. We need to know where they are in that journey and how we can help them at that point and in that time. So, how do people make decisions? Good question. Let's say I'm a leader at a community organization that deals with homelessness. What I want to do now is to walk through the steps that I might take to make a new decision related to health care with the homeless. Step one for me is to even realize that I have a need to be concerned about, say, a specific health care issue of the homeless. And how do I recognize that? Well, it could be internally, from me observing the homeless and maybe hearing their stories, or I could become aware of the problem from someone else, like a healthcare partner who reaches out and informs me about the issue and the ramifications of that issue. Of course, this is where the marketing side of our organization does some of its best work. As an external source, we can be the ones who help them recognize a need by informing potential partners of important health issues. In step two, if I'm that leader of a community homeless advocacy organization, I'm going to engage in information search to try and discover solutions to the problem that I've just identified. In essence, I'm trying to solve the pains and get the gains of solving this problem. Again, I may search my own brain, my own experiences with being around these types of situations. Or I may engage in more extensive information gathering by doing a Google search or, say, contacting experts, or perhaps even contacting you as a partner in my network. Again, this is where the marketing side of our organization can help in significant ways by providing information. We can wait for partners to reach out to us, or we can proactively reach out to them during this information search phase. In step three, the person evaluates various solutions to his or her needs. To do so, community homeless advocacy leader that we're talking about, for example, may reach out to reference groups and or opinion leaders that they trust. As network members, we need to learn who these reference groups and opinion leaders are. It'd be wise to make sure they know about our plans and have a good opinion of our organization. After all, the decision maker probably and very well will trust them more than they think they can trust us. After evaluating alternatives, in step four, the decision maker makes a decision. And of course, we need to understand that sometimes that decision is to make no decision at this time. say that you choose to partner with your organization. Congratulations. What happens right after making an important decision is that the decision maker often has what is called post-purchase dissonance. It's also called buyer's remorse. This can happen in step 5 of the chart. After making a decision, especially an important one, people often wonder if they've made a wise choice or a goof. Studies show, believe it or not, that people actually study car advertisements much more closely after buying a car than they do before. Have you ever done that? Why do you think you did it? You probably did it with the goal of hopefully helping you realize that you did make a wise decision. So what's the takeaway for us? We need to be there for our partners, helping them realize, yes, they did make a good decision and partner with us on this initiative. That's also a very important part of marketing. Of course, there are many people involved in most of our partnering decisions, and this slide just shows some of the types of folks and some of the roles that they have. If we are astute, we will try to learn as much as we can about each of these people and how they make or influence the decision-making process. There are those people, for example, who initiate or start conversations within their organizations about the pains and about partnering with you or other people or other organizations. There are also people that we call users, who are oftentimes not the deciders, and it would be wise to learn what their pains are and what gains they're looking for. For example, what do the CANs think of the current situation or about your ideas? What do the members of a particular poverty group experience on a daily basis? These and other user groups can have a tremendous impact on the decision that is made. Influential adversaries are an interesting group. They wield influence over a decision to partner with our organization, but are actually opposed to our organization or someone in our organization. For example, let's say we're trying to integrate behavioral health, let's say like mental health and substance abuse evaluation and referral into primary care clinics. And we have a few primary care physicians that are opposed to our program. It'd be wise for us to identify these people, find out why they do not like us, and then make decisions for how we will deal with them and help them understand what we're doing and why we're doing it. The third marketing tool we will examine is how to segment and develop target markets within a network. First, some definitions. What we will call the market includes all organizations who have pains and who also have the ability and willingness to buy into your program or idea. Let's say you're an organization and you're concerned with chronic health issues, and you developed a program to help manage patient health and wellness. The market in this case would include every organization who could ever potentially partner with you and for which you might be able to help them with their pains and give them some gains. The market segment is simply a subgroup of that market. The market segment shares one or more characteristics that causes them to have similar needs. For example, if you're concerned about chronic health issues, one segment might be public health organizations, a different segment would be hospitals, another clinics, another minority population advocacy groups. You get the idea. So what marketing does is to identify different market segments. But why would we spend the time to do that? The answer is simple. If we can identify segments, then we can create a unique marketing mix for each segment. Thus, for each segment, we approach them differently. After all, each segment has somewhat different needs. For example, for public health organizations, we might develop a very different offering than we do for clinics. The difference could be in the product or program that we offer, the way we price or finance the program, the way we distribute the program in some way, or the way we promote the program. For example, let's assume our program goal is to improve patient information sharing capabilities across all of our network members. One segment could be public health organizations. For these folks, we might offer a standalone module that updates a database externally, but is then funneled to a central system. It could be a program that's funded 100% by my grant, and it could be a program that is promoted primarily by advertising in their trade publication. Now contrast that example, that segment, with how we might market to a different market segment, clinics. For clinics, we might offer an integrated automatically across all clinics database system. We might fund that 50% by the clinics and 50% by us. And the program might be promoted by us using personal calls to key leaders in the clinics. I hope you see the differences in those two segments and how we're going to market to them differently because they have different needs. So how would we segment the overall market into these market segments? Well, this slide just shows you some of the ways. First, we might segment on the basis of some organization characteristics. We might segment into very large, small size organizations, or as indicated in the example before, we might segment into the type of entity. Let's say hospitals versus clinics versus public health organizations. We might segment based on how much they might use our program, like heavy users, medium users, very infrequent users. I think you get the idea. We can also segment based on their decision criteria. Of course, here we're talking about their similar pains or how we might offer gains. So one market segment might consist of organizations for which we can offer, let's say, technical support or share similar resources. Or we might segment based on which organizations could most benefit from reputation enhancements by partnering with us. For example, some can benefit a lot, others perhaps not so much because they already have a significant reputation. I'd encourage you to think about this for a minute. Think about your market for one of your initiatives. What would be a good basis for segmenting it into groups? But just segmenting the market into market segments really isn't enough because we don't have enough time and money to meet all of the different segments' unique needs. Instead, we'll just choose a limited number to pursue or target, and we'll call these target markets. You can also think of them as target audiences if that will help. Now, some organizations will just choose one target market, which in the slide is called concentrated targeting, and they'll just pursue one target market to pursue. While this is great and it allows us to really hone in on those specific needs, there's always a caution in putting all of our eggs into one basket. I've told you I'm a rural person and I've raised all of my children for 26 years on a small homesteaded farm out in the country in Wisconsin. The children every morning brought in the eggs for us to eat for breakfast, and yes, you guessed it, they always brought them in one basket. I'll never forget the day my 5-year-old, almost always spaced out Ben, I love him to death, was bringing them in. He tripped and broke all 25 eggs, every one of those 25 eggs. Yes, we had toast for breakfast. That can happen sometimes if you just pursue one target. A way to overcome this potential problem is to, of course, go after multiple target markets. The potential danger in this scenario, of course, is spreading ourselves too thin. How do you choose which route to go? Well, you look at your resources, your time, your people, your money. how different the target markets are, and you make your decision. But once you decide, then you create a unique marketing program, again, product, distribution, pricing models, and promotion for each target market that you choose. But wait, we're not done. A good marketer is always evaluating, always checking to see if we're doing a good job at meeting partners' unique needs. Are we really helping them achieve gains that are meaningful for them? Are we taking away some of their pains? I just ask you the question, do you do that now in your organization? If not, we need to change. We also try to ensure our marketing program, again, product, pricing, distribution, promotion, is continuing to work for them. How do we do that? Well, we could use the marketing research tools we talked about earlier, things like surveys, focus groups, depth interviews. We never assume everything is just going great because we want to be proactive in making good changes going forward. We also need to decide if we're targeting the right market segment. Are they going to keep needing our program, needing our support? Are they sustainable? If not, we should consider targeting some other groups. For example, if we targeted public health organizations, should we instead target hospitals or FQHCs? We've already alluded to this objective in other slides, but let's take a few minutes to talk about how we might actually develop ideas and new programs that meet real needs. And of course, there is a very logical way to do this, as our next slide will start showing us. First, we make sure we review our organization's mission, vision, and strategies. You've learned about this in previous webinars, and it doesn't ever go away. It's still very important. Any new or existing program should fit. Next, step 2, we generate new ideas that will meet our target market's needs. We've talked about many ways to do this already, including the use of marketing research. We can also see what other networks are doing that might be applicable to our situation. Finally, we may want to reach out to the network's customers and learn more about their needs and problems. For example, if we need to help change laws and build new codes, we might reach out and learn about the needs and issues of legislatures to help us understand what the issues are and why the existing codes or laws are in place. This is a very powerful way to generate ideas. Sometimes ideas that even our own partners in our network have never even thought about. But once we have ideas, we need to, in step 3, screen those ideas because more than likely they all aren't worthy of our time and efforts. There are lots of ways to do this, but involving a few potential partners really makes sense. This is where you might want to use focus groups or depth interviews. Of course, we must run the ever-important financials in step 4, and then further refine our ideas in step 5. You might then want to test out the idea of the new program in step 6 by actually rolling it out in the test marketing phase. For example, you might take a new program idea and try selling that idea to one clinic, then get feedback, and then adjust your program before rolling it out for the actual implementation, which is step 7. In all of this, your goal is still the same thing, to find problems with your new programs earlier rather than later. As you roll out your new program, it should not surprise you that adoption time will vary depending upon the organization you're talking to. Each of you can probably identify partners that would fall into each of these categories. Some are just raring to go and adopt right away. We call those people innovators, while others may be the very, very, very last to ever adopt a new idea, and we call them laggards. Now note from this chart that the groups are different in how they use information sources. Innovators, the very first to adopt new ideas, don't rely on group norms and what the rest of the network is doing because they're out in front of the pack. While the group called the majority actually rely very heavily on group norms and what the network is doing. A key takeaway in all of this is that you need to adjust your marketing program as you roll it out in order to give each type, innovators, early adopters, and so forth, exactly what they need in order to make wise decisions. I'll ask you to take a minute and just think about that. I'm asking you to identify one group or individual in your network and name the category that they fall into. So think about a group or an individual in your network. Which category do they fall into? Are they an innovator, an early adopter, majority, or laggard? So as you think about that, again, we want to be sure that we have the right information sources for partners of each type. So again, for example, for the majority group, if you just identified somebody in the majority group, we're going to help them see that others like they have adopted our program. Plus, we're going to give them lots of information on the pros and cons to help them decide, because that's what that group is looking for. We should always be adapting our services and programs based on the needs of our partners. We can do that by actually changing our offering, and sometimes that's exactly what we need to do. But we can also adapt by changing the style of our product and how it is perceived by some audience. For example, let's say we're trying to get oral and behavioral health care in public schools. It's going to be administered by school nurses. They're going to be using a telemedical application. But we're just not getting very good response from schools. We may need to secure, for example, a well-respected and well-known pharmacist to help us co-create a 30-second video clip on how the program is considered high quality. We could then share that video with the school nurses. In this case that I've just provided, we're not trying to change the product, just the perceptions of our program. And of course, marketing communication is important in this, so let's talk about it with the remaining time that we have. Take a second and think about how you communicate with your networks now. What kind of tools do you use? Do you think they're effective? How do you know if they're effective? What are some options that you would have? First, let's talk about some overall best practices for marketing communication. Number one, don't communicate your program until you create a product or service that meets their real needs and solves their real pains. Because to do otherwise is just to bug people. One ad campaign extolled my sentiments in this way totally. Don't be that guy. No one wants to be pushed into agreeing to something that doesn't actually meet their needs. Number two, communicate using methods that each individual network partner desires. Don't just use the method because it's your favorite to use or because you've always used it before. For example, you may love print ads, but if your target market is tied to social media more, guess what? Then use social media to communicate instead. Number three, make sure you highlight the competitive advantage of your product or service offering. Don't assume your target market will, quote, get it on their own. They probably won't. Number four, don't be afraid to toot your own horn. You know, folks, I've read stories of the things that you're all doing, and I'm impressed. You do great things. You help many, many people. Tell others about it, even including members that are in your own network partners. And lastly, number five, as most of you know, use branding and co-branding to differentiate and provide quality cues. You see my brand name there, Castleberry Clinics. doesn't really exist, but it also doesn't add much pizzazz, does it? But I bet your brand name does. So use your brand or your co-brand with the people that you're partnering with. When thinking of communication, most think of advertising, and that's perfectly okay. It's an important tool for many organizations. But I want to expand your thoughts and help you realize there are many other tools you can use as well, or instead of advertising, to communicate with your partners. For example, use one-on-one presentations called personal selling to present your ideas in your programs. Now, the cool thing about this is that you get feedback on your ideas, which of course ends up being a form of marketing research and information gathering. Don't forget to use the power of public relations. Even though your message might be broadcast to the general public, for example, your partners will likely see it as well, and you can even point it out to them later. You can also engage in public relations that are broadcast primarily to the kinds of organizations in your network. Not sure if you do much sales promotion, but if it works for you, have a presence at trade shows. And think about ways to create some fun ideas, like contests among your partners to generate
Steve, for providing that really valuable information that will help to lay a good foundation for what's coming, which is the building of the marketing plan. I encourage everybody to really think about some of the questions that Steve put out today and the information, and to look at the handout that was put together that has discussion questions and reflection questions for you to take back to your leadership team, to your boards, to your members, and start really wrapping your heads around all of this as you work to start building your marketing plan. There are a few upcoming TA events that are shown on this screen. There are some check-in calls will be coming in July. There are cohort calls going on. And as I said before, the next marketing webinar, the webinar to talk through the nuts and bolts of the marketing plan materials themselves, will be coming on August 16th, and we look forward to seeing you all then. If as you start to work on this, you have any questions, please